Every mental disorder explained. There are nearly 300 recognized mental disorders in the DSM-5. Most people can name maybe 5. And of those 5, they're wrong about at least 3. This is not a list of quirks, moods, or personality flaws. These are conditions that rewire the brain, reshape behavior, and in many cases, quietly destroy lives while the person smiles through it. 10. Disorders. No sugarcoating. Let's go. Depression. Most people think depression is sadness. It is not sadness. Sadness is a feeling. Depression is the absence of feelings. It's the gray static where color used to be. You don't cry because you're too sad. You can't cry because you're too empty. Depression is not new. Ancient Egyptians documented it. Hippocrates called it melancholia and blamed it on black bile in the bloodstream. He was wrong about the bile. He was not wrong that something was poisoning people from the inside. Here's what's actually happening in the brain. The prefrontal cortex, the part responsible for planning, motivation, and future thinking, goes quiet. Quieter than it should be. Meanwhile, the amygdala becomes hyperactive. So you feel threat everywhere and reward nowhere. Your brain stops producing enough serotonin, dopamine, and norepinephrine. Not because you're weak, because the hardware is misfiring. Here's the part nobody tells you. Depression physically shrinks your hippocampus, the memory center. Long-term untreated depression causes measurable brain tissue loss. It also raises cortisol to chronic high levels and accelerates cardiovascular disease. Depression is not a mood. It is a full-body inflammatory condition that happens to feel like emptiness. Over 280 million people have it right now. Most of them aren't lying in bed. Most of them are sitting in meetings, responding to emails, and saying I'm fine to everyone who asks. Next, the disorder that makes your brain very, very convinced the world is ending. Constantly. Anxiety disorder. Everyone says they're anxious. Almost no one means it the way it actually is. Anxiety disorder is not nervousness before a presentation. It is a brain that cannot distinguish between a tiger and a passive-aggressive email. To the anxious brain, both are threats. Both require survival responses. Both deserve a full cortisol spike at 2 in the morning. Anxiety is ancient and useful. Fear kept your ancestors alive. The problem is evolution never got the memo that the predators are mostly gone. The amygdala, your brain's alarm system, never updated its threat library. It's still running software designed for the savannah, trying to protect you from Excel spreadsheets. Here's the mechanism. The sympathetic nervous system fires. Heart rate spikes. Blood rushes to the muscles. Digestion shuts down. Pupils dilate. Your body is ready to run or fight. Except there's nowhere to run, and punching your inbox is not an option. So the adrenaline just sits there vibrating. Here's what nobody mentions. Chronic anxiety doesn't just exhaust you mentally. It physically degrades your body. Persistent high cortisol damages the hippocampus, suppresses the immune system, causes chronic inflammation, and increases the risk of heart disease. Your brain convinced you there was a predator every day for 10 years, and your body paid for it in organ function. Roughly 300 million people worldwide live with anxiety disorders. Most of them look completely fine. Most of them are not fine. They're just very, very good at performing fine. Up next, the disorder that doesn't just change your mood. It changes who you are entirely twice. Bipolar disorder. Bipolar disorder is not moodiness. It is not being happy one day and sad the next. It is a neurological condition that cycles between 2 completely different neurological states, each one lasting days, weeks, or months. Each one convincing you it is the only state that has ever existed. The term manic depressive was used for most of the 20th century. Emile Kraepelin documented it in 1899 as a distinct condition from schizophrenia. For decades, it was misdiagnosed, overdiagnosed, and treated with substances ranging from lithium salts to lobotomies. The lithium actually worked. The lobotomies did not. During mania, dopamine and norepinephrine flood the brain. You need no sleep. You have unlimited ideas. You are, without question, the most intelligent person in any room. You make decisions, financial, romantic, professional, that feel like genius and are objectively catastrophic. During depression, the flood drains. You are left with the decisions, the consequences, and none of the confidence that made them feel reasonable. Here's the part nobody tells you. Bipolar disorder has one of the highest rates of misdiagnosis in psychiatry, often confused with depression, ADHD, or borderline personality disorder. The average patient waits 6 to 10 years to receive a correct diagnosis. During that window, wrong medications can trigger mania and accelerate the cycling. The cure, in the wrong hands, becomes the accelerant. Bipolar disorder affects around 45 million people globally. Many of them are extraordinarily productive, creative, and high-functioning, until they're not. The line between a gift and a disorder is mostly about whether you survive it. Next, a disorder so misrepresented by film and television that most people's understanding of it is entirely fictional. Schizophrenia. Schizophrenia does not mean split personality. That is, dissociative identity disorder, and it is a different thing entirely. Schizophrenia means your brain generates experiences, voices, visions, beliefs that feel completely real and are entirely internally produced, and are completely indistinguishable from reality to the person experiencing them. The word schizophrenia was coined in 1911 by Eugen Bleuler. It comes from the Greek for split mind, referring not to a split between personalities, but between the mind and reality. Freud thought it was psychological. He was wrong. It is neurological, genetic, and partially developmental, emerging most often between ages 16 and 30, frequently triggered by stress or cannabis use in those with genetic predisposition. Here's what's happening in the brain. Dopamine pathways become dysregulated, overactive in some areas, underactive in others. The result is a fractured perceptual system. Positive symptoms appear: hallucinations, delusions, disorganized speech. Negative symptoms follow: flat affect, social withdrawal, inability to feel pleasure. The brain doesn't just misinterpret the world, it invents one. Here's what nobody mentions. Schizophrenia reduces life expectancy by 10 to 20 years. Not primarily due to suicide, though that risk is substantial, but due to cardiovascular disease, diabetes, and the metabolic side effects of antipsychotic medication. The treatment is partially responsible for the complication. That is the deal being offered. About 24 million people live with schizophrenia worldwide. Roughly half of them are not receiving any treatment. Many of them are not diagnosed. Some of them are on the street. Some of them are writing things that make no sense to anyone else, and all the sense in the world to them. Next, the disorder that convinced an entire generation it was a personality trait and a quirky hashtag. OCD. OCD is not about liking clean desks. OCD is not a preference for symmetry. OCD is a neurological loop in which your brain generates an intrusive thought, categorizes it as an existential threat, and demands you perform a ritual to neutralize the threat. It provides 5 seconds of relief, and then immediately generates the thought again. It is a subscription you never signed up for and cannot cancel. Obsessive-compulsive disorder has been documented since at least the 17th century, when religious figures described being plagued by blasphemous thoughts they couldn't control. For centuries, it was treated as a spiritual failing, proof of weak faith or moral corruption. The person was told to pray harder. The loop continued. The loop always continues. The mechanism is a malfunction in the corticostriato-thalamocortical circuit, a feedback loop in the brain responsible for filtering what requires action and what can be ignored. In OCD, the filter is broken. Every intrusive thought gets flagged as dangerous and urgent. The compulsion is an attempt to reset the alarm. The alarm resets itself in seconds. Here's what nobody tells you. OCD's most common intrusive thoughts are not about cleanliness. They are about harm. Harming yourself. Harming the people you love most. The person with OCD is not dangerous. They are horrified by the thought. The horror is the disorder. They perform the ritual not because they want to hurt someone, but because they are desperately trying not to. OCD affects around 2.5% of the global population. Most of them never tell anyone what their actual intrusive thoughts are, because the thoughts are unspeakable, and the disorder makes them believe that having the thought means something terrible about who they are. It does not. Next, the disorder that is technically caused by other people, and yet somehow the person who has it is the one left to deal with it. PTSD. PTSD stands for post-traumatic stress disorder. The name is almost insultingly mild. What it describes is a nervous system that experienced something it could not process, and now weeks, months, years later, continues to re-experience it as if it is still happening. Not as a memory, as a present event, as now. Shell shock, combat fatigue, war neurosis. PTSD has been documented in soldiers since ancient times, but was only formally recognized as a diagnosis in 1980. Before that, veterans were told to toughen up. Civilians were told they were weak. The disorder is real. The diagnosis was not. Recognition arrived decades after the damage. Here's the neuroscience. Trauma disrupts the hippocampus's ability to contextualize memory, to file events as past. The amygdala records the emotional charge of the event without the timestamp. So the brain cannot classify it as over. A sound, a smell, a texture becomes a trigger. And the nervous system fires the full emergency response, as if the event is happening right now, in this body, in this moment. Here's what nobody mentions. PTSD is not exclusively a veteran's condition. Sexual assault survivors, accident survivors, childhood abuse survivors, medical trauma survivors. PTSD is one of the most common mental disorders in the general population, and one of the least diagnosed, because most people with PTSD do not call it PTSD. They call it not being able to sleep, not being able to trust, not being able to explain why a certain song makes them leave the room. An estimated 70% of adults experience at least one traumatic event in their lifetime. Around 20% of those develop PTSD. That is hundreds of millions of people quietly running emergency protocols in the middle of ordinary days. Next, the disorder that was spent decades being called laziness, stupidity, and a lack of discipline by teachers, parents, and the kids themselves. ADHD. ADHD is attention deficit hyperactivity disorder. The name is misleading. People with ADHD don't have a deficit of attention. They have an inability to regulate it. They can hyperfocus on something genuinely interesting for 6 straight hours without eating, sleeping, or acknowledging that other humans exist. What they cannot do is direct that same attention towards something that doesn't interest them, no matter how important it is, no matter how many times they try. ADHD was formally described in 1902 by George Still as defective moral control. For most of the 20th century, it was treated as a behavioral problem, a discipline issue, a parenting failure, a character flaw. Children were punished for symptoms they could not control. Many of them spent entire childhoods being told they were broken. Some of them believed it. Here's what's happening neurologically. The prefrontal cortex develops more slowly in people with ADHD, and in some cases, functions differently throughout life. Dopamine and norepinephrine regulation is disrupted. The brain struggles to sustain attention without novelty or urgency. It is not a motivation problem. The brain's reward signaling is structurally different. Here's the part nobody tells you. ADHD is not a childhood disorder that people grow out of. Approximately 60% of children with ADHD carry the condition into adulthood. Adult ADHD is massively underdiagnosed, especially in women, who present differently and were largely excluded from early research. Many adults diagnosed at 35 or 40 describe it as the first time their entire life suddenly made sense. ADHD affect around 5% of children and 2.5% of adults globally. Many of them are very intelligent, very creative, and working approximately 3 times as hard as everyone else just to appear functional. Next, the disorder that turns human relationships into the central catastrophe of a person's entire existence. Borderline personality disorder. BPD is not drama. BPD is not manipulation. BPD is a condition in which the emotional regulation system, the internal mechanism that most people use without thinking to manage feelings, relationships, and self-perception, is fundamentally impaired. The result is a life experienced at full volume, all the time, with no mute button and no remote control. BPD was added to the DSM in 1980. Before that, Patients were described as too difficult, too intense for neurosis, not psychotic enough for schizophrenia. They existed in the borderline. The name stuck. The stigma stuck harder. For decades, BPD patients were labeled manipulative, treatment-resistant, and hopeless. Clinicians were actively taught to avoid taking them as patients. The neuroscience involves a hyperactive amygdala combined with an underactive prefrontal cortex, the exact combination that produces intense emotional reactions with minimal top-down regulation. Additionally, the brain's sense of self, the stable internal identity most people carry as background, is absent or unstable. The result is a person who experiences emotions at 3 times the normal intensity, for 3 times as long, with very little sense of who they are when the emotion is over. Here's what nobody tells you. The majority of people with BPD have histories of childhood trauma, emotional neglect, or abuse. The disorder is not a character flaw that appeared out of nowhere. It is in many cases a nervous system that adapted badly to an environment that was not safe. The behaviors that get labeled as manipulative are often desperate, unskilled attempts to manage unbearable internal pain. There is a difference. It matters. BPD affects approximately 1 to 2% of the general population and up to 20% of psychiatric inpatients. It has one of the highest suicide attempt rates of any mental disorder. It also responds extremely well to a specific therapy, DBT, when it is actually provided. It is frequently not provided. Next, the disorder where the body becomes the battlefield, and the enemy is a number on a scale. Anorexia nervosa. Anorexia is not a diet gone too far. Anorexia is a psychiatric disorder with the highest mortality rate of any mental illness, higher than depression, higher than schizophrenia, higher than bipolar disorder. It is a condition in which the brain systematically distorts the perception of the body and attaches survival-level importance to restriction, and activates reward pathways in response to starvation. The brain learns to treat not eating as safety. That is the trap. Anorexia has been documented since at least the 12th century, when religious women who starved themselves were venerated as saints. In the 19th century, William Gull named it and described it as a medical condition. For most of the 20th century, it was treated as vanity, attention-seeking, or middle-class teenage behavior. None of those are diagnoses. None of those explain a mortality rate of 5 to 10%. The neuroscience involves the serotonin and dopamine systems, but differently than most disorders. In anorexia, restriction literally reduces anxiety. The act of not eating activates the dorsal striatum and produces a temporary sensation of control. Meanwhile, interoception, the brain's ability to perceive internal body signals, like hunger, becomes blunted. The person genuinely does not feel the hunger that is destroying their organs. Here's what nobody mentions. Anorexia kills people not just through starvation, but through cardiac arrest. The heart muscle wastes along with the rest of the body. It causes bone density loss, infertility, hormonal collapse, and irreversible neurological damage. And it is one of the most treatment-resistant disorders in psychiatry, not because patients don't want to recover, but because the disorder makes the brain experience recovery as the threat. Getting better feels to the brain like dying. Anorexia affects an estimated 1% of women and 0.3% of men, but eating disorders broadly affect over 70 million people worldwide. Many of them look fine to you. Many of them are not fine. Many of them will not survive. Next, the disorder that doesn't feel like a disorder to the person who has it, because the entire architecture of the condition is built to prevent self-awareness. Narcissistic personality disorder. NPD is not arrogance. It is not confidence. It is not just being difficult. Narcissistic personality disorder is a structural deficit in the self, a core of profound shame, fragility, and emptiness, wrapped in a carefully engineered exterior of superiority, entitlement, and control. The grandiosity is not the disorder. The grandiosity is the defense against the disorder. The person you see is not the person inside. NPD, as a clinical concept, traces back to Freud, but the modern diagnosis was formalized in 1980 in the DSM-3. Heinz Kohut argued in the 1970s that NPD developed from early failures in parental mirroring, The child never received healthy validation of a real self, and so constructed a false one. The false self requires constant external reinforcement. The supply is never enough. It is never structurally ever enough. Here is the mechanism. The person with NPD has an extremely fragile implicit self-esteem. The unconscious sense of self-worth, masked by an inflated explicit self-presentation. When that explicit image is challenged by criticism, rejection, or simply being ignored, the shame underneath floods through. This is called narcissistic injury. The response to narcissistic injury is rage, devaluation, or complete withdrawal. The people around the person experience this as cruelty. Inside, it is panic. Here's what nobody tells you. NPD is one of the most difficult conditions to treat because the disorder itself prevents the self-awareness required to seek treatment. The person with NPD does not generally believe something is wrong with them. They believe something is wrong with everyone else. Most people with NPD never receive a diagnosis. Most of the people who know them receive one instead, usually PTSD. NPD is estimated to affect 1 to 5% of the general population, with higher prevalence in certain professional environments and positions of power. The people around them absorb the damage. The people around them are often the ones reading articles like this one, trying to understand what just happened to them. 10 disorders, billions of people, all of them walking around in ordinary-looking bodies, in ordinary-looking lives, carrying neurological realities that most people will never see and almost no one will ask about. Mental illness is not rare. The conversation about it is. You just had it. Now you can't say you don't know.